Fall in blood pressure is not very uncommon and is not of much significance if the people are young. But in elderly people, if there is a persistent fall in blood pressure lower than 90 by 60 millimeter of mercury, that can be a cause of concern. This situation or this condition, when the blood pressure remains less than 90 by 60 millimeters of mercury, is called hypotension. The most common symptom of hypotension is dizziness or lightheadedness. One has to be very careful or alert when one has repeated episodes of dizziness and lightheadedness, especially when the person gets up from a lying position. This is the most common symptom. Other symptoms include transient attacks of fainting. Now, this is very, very important because a fainting attack can cause a person to fall down and injure himself. Other less common symptoms are fatigue, nausea, lack of concentration. Fall in blood pressure is usually transient and does not require any medical intervention. But if the attacks of fall in blood pressure are very frequent, then a medical intervention is required. A doctor usually advises basic investigations like regular blood sugar monitoring or regular blood pressure monitoring, an ECG of the heart, an echo of the heart, very important. And rarely in extreme cases, there is a test called a tilt table test, which is usually done in super specialty hospitals. Treatment is very important, again for the elderly, especially if they are having persistent attacks of low blood pressure. Usually the treatment is of the underlying cause. Whatever may be the cause, the treatment is as per the cause. Basic things required are access to increase the intake of water, increase salt intake, very important. To wear pressure stockings. Many people are asked to wear pressure stocking because that pumps the fluid back towards the heart. Regular exercise, control of their intakes. So it is very essential to understand the symptoms, to first identify that a person is suffering from hypotension and to take appropriate measures so that the people or the elderly people may not suffer because of hypotension.